Hello, my name is Dr. Stephanie Paulmeno. I'm the co-chair of the health sector of the Charter for Compassion. I'm part of the panel today to talk about the Earth Month panel discussing the message of Laudato Si, and I'm going to be discussing that from the health perspective. We're going to be looking at Pope Francis's message, and his message was that there's a very fragile balance between the health of Mother Earth and the health of the people, planets, the animals that live on it. And many amongst us seem to have become blinded or insensitive to our global connectedness with all the others, creatures and beings and things that live on the earth or the ecosystem that makes up the earth. For decades, the actions of we people have been adversely impacting the Earth's ecosystems to the detriments of many other creatures on Earth, including our ecosystems, the air, the water, the soil, the climate, our biodiversity. And these disruptions have led to or contributed to so many of our global social issues, as well as health issues, because they are connected. We have a poorer quality of life for the less advantaged of us on this planet in many countries. We have social disruption, which we see every day. We have inequities and health inequities. We have human insensitivities that embrace our economic systems, our political systems, our scientific and technology systems. And all of these tend to favor the wealthy and the more powerful amongst us. And they often tend to disenfranchise our poor and people of color. Again, not just in America where I live, but in many places around the world. Now, the Laudato Si addresses the gospel of creation, and it points out that it's intended for human beings, it was intended for human beings to be the caretakers of the earth, not that we be above it or above any other creatures, nor that we should exploit some of us to the detriment of others. We overcrowd and overpollute our cities where many of our less advantaged live. Animals have been displaced by urban expansion. We have our land and our water that are sources of food for us, yielding less of their former bounties in many places around the world. We have indigenous people who have often been exploited because of mining, gentrification, deforestation, and industrial growth in many places. Now, the Laudato Si is now a component of the Catholic Church's social teachings, which as a public health professional, I think is wonderful because we'll be exposing children from an earlier age to the teachings. It calls for ecological conversion in how we think and how we act. We technocrats must begin to think about the impact of our actions on the world. Our technological progress has lagged or seemed to have lagged behind our sense of human responsibility, our values, or our conscience about the impact we have on and the exploitation impacts on others. Workers are losing jobs as their roles are turned over to technology. We can see this with a simple phone call. Now, many years ago, when I studied nursing initially, the World Health Organization had a definition of health, and they stated that it was the state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. So you don't have to have a disease to not be considered healthy. In the US, we have a national health plan. It's called the Healthy People, and it's updated every 10 years. It includes environmental health. Health has a lot of facets to it: physical, mental, spiritual, access to health care, health equity, social justice. Can we afford health care? Is the care compassionate? Do we feel like we're being cared for? Is our care coordinated so you may get the best care in the world into place, but if you're discharged home with an inoperable discharge plan, you're not likely to have good outcomes. Health literacy is a big aspect of healthcare, and we need culturally competent people as health educators to be able to reach all the people in our country, our community, our world. The health of our planet's ecosystems also impacts the health of all of us. Every creature and everything that lives on our earth is impacted by the health of our ecosystem. So when I ask what impact does environmental health have on health, I would say it's great. Let's look at polluted water, for example. There are 7.15 billion cases of waterborne illness every year in the US, according to the CDC, and those are linked to environmental issues. Many of our lower income communities and communities of color tend to live in these areas where there are more environmental pollutants. And why is that? Because city planners make decisions, money is allocated to manage the resources. How often do you think you'd find somebody who was a wealthy white community dweller living in an area with this type of pollution that we see in our lower income areas? I would venture to say very rarely. Now, what about air pollution? The State of the Air report, written in 2023, found that despite decades of remediation to clean up known sources of air pollution in my country, the USA, nearly 36% of us, almost 120 million people, still live in places with unhealthy ozone levels of particulate pollutants. So let's look at pollutants: dust, smoke, particulates, carbon monoxide, ozone, nitrogen oxide, pollen, the combustion of fuel fossils. All of this contributes to between 100,000 and 200,000 annual deaths in the US alone. Pollution is linked to all kinds of diseases like lung cancer, heart disease, strokes, asthma, pulmonary diseases of every sort. These are all higher in lower income areas and in communities of color. What about noise pollution? Persistent noise has been linked to stress and hearing loss. And then we have the weather and climate changes. In the US, in 2023, we had 28 disasters that resulted in 492 direct or indirect fatalities. That's the highest number we've had in the United States since 1980. Climate change is dreadful in many ways. It destabilizes our food supply, which is a huge health factor. It impacts adversely our mental health. It impacts the extent of people dealing with long-term and chronic illnesses. Think of flooding, power outages, and damaged infrastructure that occur with weather events. These also lead to disrupted healthcare services. So if your problem is related to the weather inclemency or related to your own health, you may not be able to get to healthcare. Warm water and air leads to increased waterborne pathogens. Warm air and droughts lead to crops and livestock becoming more susceptible to bacteria and toxins. We have lower income housing that tends to be less efficiently built to protect its inhabitants against the heat and the cold weather and inclement weather. Many low-income workers have outdoor jobs, so they have greater exposure to inclement weather extremes. And let's look at the other environmental factors. Think of your drinking water. If you recall Flint, Michigan, they spent nearly 5 years trying to fix the water pipes, the lead water pipes in that community. Do you think for a moment that in a wealthy white community that it would have taken 5 years to correct that problem? There was another community that if you held a match to the water, it would go on, it would flame. Okay, blood levels in children. Lead paint is still in a lot of older homes, a lot of places where our less advantaged live. Lead levels are still a problem. We have environmental situations related to hazardous waste sites. Toxic pollutants are still being released into the air. We have unsafe conditions because of annual and seasonal insecticides and defoliants that impact our soil, our air, and our water. So let's look at some measures to improve environmental health. The Health and Environment Alliance offered 10 ways to protect our health and our environment. And they start by beginning teaching children at a young age to honor and protect the world we all live in and everything that's in it. And that's part of the Laudato say. We can take steps to reduce pollution of our air, water, and soil. We can do this politically, educationally, through community activities, activist activities. We can increase the safety net for the most disadvantaged or vulnerable amongst us. And how do we do this? By housing improvements, by planning and zoning scrutiny, by funding health testing and screenings, particularly in our disadvantaged communities. We can improve access to affordable quality care. We can improve the regulatory oversight and monitoring of various known toxins. We can tighten air, water, and soil pollution standards and enforcement. We can stop funding industries that increase pollution in air, soil, and water. This came out of a Harvard study. Consider factors that adversely or favorably impact our environmental health issues when we're allocating grant funds. Why should we fund organizations that are poisoning our people, our animals, our land, soil, air, our ecosystems? We can place an emphasis on funding and gathering meaningful science and evidence-based data on environmental conditions that impact the health of the planet and all that live on it. So in conclusion, I would say, I think we need to restore compassionate care not only to people and other creatures that we live with, but also to the world in which we live. Healthcare inequities and disparities for different groups of people fly in the face of the Pope's Laudato Si message for how we need to treat our planet and every inhabitant of it. Thank you for listening. Have a good day.